Hi, my name is Sarah and I'm going to be your nurse today. I wanted to go over some information with you about some things that are restricted during pregnancy or some things that you just need to kind of limit and be aware of. First of all, there are some foods that you should avoid eating while you're pregnant. Raw fish or raw shellfish, raw meat or raw shellfish can cause salmonella or toxoplasmosis. Raw eggs can also cause salmonella. And salmonella increases your risk for premature birth. Toxoplasmosis can cause brain damage or blindness in the fetus, and so those are things that you would want to avoid. Other things to avoid would be deli meats, soft cheeses like feta or gorgonzola or brie, or also unpasteurized dairy products. Those can infect you with a bacteria called Listeria, and that is a bacteria that can also cause premature birth. And other things that you would want to avoid would be fish that have high levels of mercury. So that would be mainly shark, mackerel. Those have high levels of mercury, so it'd be best not to eat those. Tuna can sometimes have high levels of mercury too, but if you eat tuna from a can, that is okay, but it should be limited. Another thing to limit while you're pregnant is caffeine. So you should limit that to less than 200 milligrams per day, which is about 2 cups of coffee per day. And that would be a good safe level to be able to limit that to. Other things that you should avoid are some medications. So herbal medications, herbal supplements, the benefits of those are not really known during pregnancy, nor are the effects on pregnancy or on the fetus known very well. Herbals are not regulated or tested or studied by the FDA, and so just much is not known about them, or much is not known. And so it is best to just limit or avoid those completely while you're pregnant. Also, ibuprofen, aspirin, Aleve, those kinds of medications are non-steroidal anti-inflammatories, and those medications should also be avoided while you're pregnant. The reason is that they can cause some blood flow problems and increase risk for bleeding, especially in the third trimester. Some medications like Sudafed for cold symptoms, or benzocaine, which can be found in sore throat sprays or lozenges, those should be avoided during pregnancy as well. So what medications can you take? It's safe to take Tylenol. So if you have pain, you can take Tylenol throughout your pregnancy. It's also okay to take Benadryl and chlortrimeton. So those are some medications that you can take for allergies or cold symptoms, and that's okay to take. Another thing that we want you to take is a prenatal vitamin, but it's important to take one that is specifically a prenatal as opposed to just a regular multivitamin, because a prenatal vitamin has the things in it that are specially formulated for a pregnant mom. So those would be good to take while you're pregnant. Some other things to avoid are some environmental things. So if you have a cat, it's best to avoid the litter box and cat feces. So it can cause or it can expose you to toxoplasmosis, which, as I mentioned earlier, can cause brain damage or blindness for the fetus. So use it as a good excuse to be able to, have your partner or friends or family or somebody else clean that litter box for you while you're pregnant. Another thing to avoid would be hot tubs or saunas. So while they're very relaxing to be able to be in a hot tub or a sauna, raising your body temperature, especially in your first trimester, can cause some birth defects. So best to avoid those. Another thing to avoid, or at least limit your exposure to, would be some household cleaners and paint fumes. So if you don't have to paint your nursery, then don't. It's just best to avoid it. So it's also very important to make sure that you are avoiding drugs, alcohol, and smoking. So alcohol crosses the placenta and can be harmful to your baby. It can cause premature birth, stillbirth, and so it is best to avoid drinking alcohol. It can also cause fetal alcohol syndrome, which causes lifelong disabilities for your child. Smoking has a lot of the same effects. It can cause stillbirth, premature birth. It can also cause low birth weight. It is also a cause of lung problems, birth defects such as a cleft lip or cleft palate. So it's good to avoid that. It can also cause low birth weight for your baby. So you want to avoid smoking. Drugs are also harmful to your baby because your baby can be born addicted to drugs, and then they have to go through that withdrawal process. If you use IV drugs, that exposes yourself to an increased risk of HIV, which can also be passed along to your fetus. So travel. A lot of women wonder if they can travel while they're pregnant. And the answer depends upon how healthy you are and how healthy your pregnancy is and how far along you are. So if you're pretty healthy, you don't really have any underlying medical problems, and your pregnancy has been healthy and uneventful, then usually you can travel by plane domestically up until 36 weeks of pregnancy. And then you can also travel between 32 to 35 weeks, up till then anyway, internationally. Now, when you travel internationally, it's important to note that you do need to travel to other countries that have adequate health care. You don't want to travel somewhere that has poor health care or that has bad water, so you need to have safe water to drink. You also need to travel to another country that does not require immunizations prior to traveling there. You'd also want to make sure that it is a country that doesn't have any illnesses like malaria or something similar to that, like Zika virus or something. And if you have a high-risk pregnancy, you would be able to travel up until about 24 weeks. If you are traveling by a car or by airplane, and you're going to be sitting for long periods of time, it's important that you get up and move around, walk around every 1 to 2 hours. So if you're driving in a car, you need to stop and take some breaks and walk around a little bit. If you're in an airplane, get up and walk around the cabin. But you want to make sure that it's safe to do so. If there's a lot of turbulence or something like that, that can throw you off balance and put you at risk for falling, which can be also dangerous. So be careful about that. Another thing that you can do, a reason to not sit for long periods of time, is because it can lead to increased edema in your feet and in your legs, and most importantly, it can give you increased risk for blood clots. Now, something that you can do to avoid that, in addition to getting up and walking around every 1 to 2 hours, is you can do some leg exercises where you move your ankles and your feet around a little bit, and that kind of helps get the blood moving around in your legs. Another thing you can do is to wear compression stockings. So dental visits. Also on traveling, I apologize. On traveling, you want to Make sure that you're not traveling. Air travel is not suitable. If you have severe anemia or sickle cell anemia or cardiovascular disease, air travel would not be preferred. Dental visits. So if when you find out you're pregnant, it's been more than 6 months since you've seen the dentist, it's a good idea to go ahead and schedule an appointment at that time. So if it's not been 6 months, then it's best to wait until your second trimester to go ahead and see the dentist. But good oral care and good dental care is important while you're pregnant. One of the common dental problems that women have when they're pregnant is gingivitis, which is inflammation of the gums. And studies have shown that there's a relationship between gingivitis and things like gestational diabetes or preeclampsia. So it's important to make sure that you don't develop those kinds of problems. If you need to have any dental work done or need to get any dental x-rays while you're pregnant, those things are okay to do if it's necessary. If it's something that can wait, a dental procedure or an x-ray that can wait until after you've delivered the baby, then it's best to go ahead and wait. So that's all the information that I have for you for now. I hope it's helped to answer some of your questions. Please do let me know if you have any other questions or concerns. Thank you.